As a practicing family physician, I know that medical care can only influence about 20% of a person's health. The facts are clear. Where we live, our daily habits, access to transportation, education and jobs, and social connections have considerable impact on our health. Children of today face unprecedented challenges in many of these areas, especially in rural areas like Waterville, Maine. Did you know that today's youngest generation is the first to have a shorter life expectancy than their parents? Today's overweight and obesity rates are startling. In 2017, Maine's childhood obesity rate ranged from 13 to 19%. Because of the related chronic conditions and costs, Inland Hospital in Waterville has committed to change the numbers and to improve the lives of those affected. The question we asked ourselves is, what can healthcare do about what is occurring beyond its doors? More than clinical interventions and education programs, Inland needed a way to reach the environment that most affects a child's health, the family in its local community. Because in one generation, family life has changed in the US. No longer are two-parent homes the norm, and even when there are two parents, both are often working, leaving little time for family meals and activities. Gone are the days when mum sent kids to play outside until dark. And for families living in poverty, it's even worse. There are fewer safe places to play and fewer healthy foods. Weekend and after-school programs can be financially out of reach, often with the added barrier of lack of transportation. What to do? It just so happens that in 2006, Dr. Tori Rogers at the Barbara Bush Children's Hospital began Let's Go 5210, a prescription for childhood obesity and disease prevention, a formula for culture change. Since then, Inland, the MHS, and other health systems across the state have joined forces with Dr. Rogers in adopting and disseminating the Let's Go 5210 model, focusing on changing environments and policies that influence lifestyle behaviours wherever children and families live, learn, work and play. The 5210 numbers represent lifestyle goals that are easy to understand and implement each day. It goes like this: 5 fruits and veggies, 2 hours max of screen time, 1 hour of physical activity, and 0 sugary drinks. A good prescription for us all, really. The community health improvement quandary is, how do we reach everyone in our community to establish lifelong healthy habits? What does it take to create a culture of health? Focusing on the one of 5210, Inland began the Family Fun series in 2012 to help make physical activity a daily part of life. Monthly activities encourage local exploration and offer families small incentives for participation. Free to all, Inland's Family Fun series partners with local groups across our region to offer multiple kinds of experiences and appeal to a wide range of interests and abilities. That first year, we reached out to our friends who we knew also cared about growing healthy kids. Friends like the Alphon Youth Centre and Waterville Parks and Recreation. They agreed to join us, and we did fun things like swimming, skating, paddling, and biking. Now look who else has collaborated with us along the way. Just in the past year, we teamed up with 28 community partners for more active family fun. From fall festivals to creative arts activities, Open Farm Day to Great Maine Outdoor Weekend, and Healthy Kids Day. Together, we can have more fun. And what has happened? Over the past 5 years, 1,700 families, 3,900 kids and their grown-ups have explored local resources like Quarry Road and Inland's own trails, and discovered that being physically active can be fun and natural right here in our community. What else happened? Inland invested in a full-time Let's Go coordinator. Bailey Doughty is there in the blue shirt. She provides Let's Go support in local schools. Gardens are popped up, lunch menus are healthier, physical activity is built into daily lessons, and water is a more popular beverage of choice. Where has the Let's Go programme gone and grown into over the past decade? Last year, there were almost 1,000 Let's Go sites in more than 200 towns across Maine and New Hampshire. The 5210 message can now be found in nearly every state in the nation. What's happening in doctors' offices? In Maine, more than 500 clinicians engage families with their 5210 Healthy Habits survey at well child visits, including inland providers like me and Dr. Lorraine Parody, seen here at the Family Fun series, sharing with kids the amazing fact that there are 16 teaspoons of sugar in a regular soda. What next? How can we foster a society where everyone has a chance to live a longer, healthier life? How do we make the healthy choice the easy choice? Personally, for our own health, and for the ones we love, and to enhance the health and well-being of our community. Remember, the best way to predict the future is to create it. Part of the answer is in working together as business and community leaders, parents, grandparents, educators, to create an active, healthy environment. We're headed in the right direction. The childhood obesity rate is stabilizing, but there's still work to do. Learn more about the 5210 Let's Go at inlandhospital.org, and I invite you all to join us at our next Family Fun Series event, a Winter Fun Day, on Sunday, February 18th at Quarry Road Trails. Thank you.